Hi, my name is Avin deSilva, and I'm with Sia Solutions, a platform aimed to vet recently unemployed or displaced people into the healthcare industry. COVID-19. We see it in headlines every day. This extremely infectious and fatal virus has turned the average American's lifestyle upside down. There are two groups of people that I want to bring attention to that have been heavily affected by this virus. Overwhelmed. Healthcare clinics are being overwhelmed at the moment. We see that hospitals in the US are facing hardship when attempting to solve the issue of crowded healthcare centers and at having the adequate amount of manpower to really respond to this influx of patients. Unemployed. We see that another heavily affected group of people are hospitality workers. Due to the implementations of social distancing, most of these people who worked in the hospitality service, such as retail or restaurant business, have found themselves with no source of revenue. Considering that like about 60% of Americans can't afford a surprise expense of like $1,000, these people are in desperate need of some sort of answer, and they need more than just a government stipend or handout. I want to also bring attention to the healthcare industry. This particular industry is in limbo, debating on how it should address the many different needs that it must respond to. Although overall traffic to these hospitals have increased, the need for specialized surgeons and non-essential workers has become a non-priority, while jobs related to COVID-19 have shot up in demand. We're most interested in the demand for entry-level positions in the healthcare industry, as these require minimum amount of hours to get qualified in and are most suitable for these people in hospitality to get into. Getting started in the healthcare industry can be intimidating for most, especially if one kind of has this beginning mindset that they don't belong in this particular industry. However, the reality is that with enough focus and attention to completing these certification trainings, one can easily find a starting position in these clinics and hospitals that are in need. Okay, we could provide the steps and cues for an individual to get certified. We're targeting basic positions that require the BLS or basic life support and CNA or certified nursing assistant certifications. These are the most basic certification one needs in order to get started in healthcare. Step two of this process is networking with clinics and hospitals for positions that are in demand. And we're the ones acquiring those laborers to do those said tasks. We search out for these clinics who have posted openings for these entry level positions and pair them up with people that we've recruited through our platform. So here you see that this is the main layout that you see on the desktop. Over to the right, it's very easy to see what certifications or qualifications one has and what they lack. And to the middle of the screen, we made it really intuitive and simple to see which exact clinics and hospitals are recruiting or trying to get these spots filled as soon as possible. And our mobile app mirrors the same sort of idea. We really wanted to streamline and simplify the process of getting started within the healthcare industry. So there's always been a need for these entry-level healthcare workers. According to the US labor statistics in 2018, the turnover rate for these positions was 8.4%, meaning that there is about 130,000 available positions. On contrasting to this, there are 7.1 million unemployed peoples. So there's kind of this overlap between those lacking a job and these positions. Now, due to COVID, there's been a sharp increase in demand for these positions, going up to 300,000 available positions. And on top of that, the unemployment rate has skyrocketed due to social distancing, with 26.5 million individuals filing for unemployment, increasing the number of potential fits for these positions. We want to build this platform as soon as possible, and using our $10,000 non-dilutive grant from Blackstone Launchpad, we can finance these efforts to get the groundwork done. We're networking with Workforce Solutions, one of the biggest unemployment offices in Houston, as well as local clinics and hospitals around the Houston area to get these people connected as soon as possible. And our main kind of core value, or we really want to go to, stems from this proverb: give a man a fish and you feed him for a day, teach a man to fish and you feed him for a lifetime. We at SIA have our own spin on this. Give a man a handout and you feed him for a day, teach a man skills in healthcare and you feed him for a lifetime. Sia's goal is to empower communities and give them the ability to help themselves without relying on some sort of stipend. Hopefully, you can see a future with Sia, and thank you for your time.